Hi everyone, it's Dr. Wibbenmeyer, and I wanted to discuss the coronavirus, probably in a different style or in a different way than what you're getting from other platforms. But I've been getting a lot of questions from patients and people who follow me who are concerned, they're confused, they don't really know what to do. And while I'm not an infectious disease specialist, I'm not a microbiologist, I do know that there's a lot of information that could be provided that it's just not. A lot of the information that's being provided and being offered up from our news reporters, from our government, from the CDC, while I'm not saying ignore those pieces of information, it's just at a different level because the CDC is really focused on collecting data and research on this current and new virus, and it's not offering really usable information. So just take that into consideration when you are trying to weed through some of the information that you're trying to find to implement to protect you and your family. I've been doing a lot of research on my own, as well as I've been in contact with some of the best top doctors around the country who are dealing with this in real time, dealing with real patients, and bringing forward their clinical nuggets and some of the research that they've been doing to offer up implementable information for us to provide to you. So I want to take the politics out of it. I want to just offer up some of the nuggets and some of the information that I've been gathering and consider this a briefing for that. So what we do know about the virus is that it does not discriminate. So it does not discriminate against age, race, sex, socioeconomic status. While it does favor, and the people who are more susceptible are the elderly, we are finding that anyone can get this, but we also are not certain about underlying conditions and the true health of that individual. So people are claiming, oh, this was a healthy individual that got it and died. Well, we don't truly know the role, or I'm sorry, the underlying issues that that patient may have been dealing with, and I think that's just going to take a while to really figure out, how this virus attacks individuals. What we do know is that this virus cannot be defined by a cluster of symptoms, such as a fever, body aches or chills, or a sore throat. There are a lot of people who probably have the virus who are walking around asymptomatic, and we're missing a big chunk of the population, especially people who have autoimmune diseases. There's a lot of people who have autoimmune that don't actually present with a febrile response to some sort of illness or virus, and there's millions of Americans that have autoimmune disease. So I just think that we're really chipping away the tip of the iceberg with this, and we're missing a large amount of the population. As far as the transmission goes for this virus, we do know that it's airborne, and that the first entry point is going to be the mucosal membranes of the eyes, nose, and mouth. The virus can stay suspended in the air for up to 30 minutes until it settles down onto a surface. They're finding through research that the virus favors metal and plastic, meaning that it lasts longer, up to 72 hours on those surfaces. Now, the viability of that virus is lowered within that 72 hours, but it's still there, and so that's why you have to be extra cautious about things that you're touching, and then washing your hands before you touch someone else or your face. If try to avoid touching your face. That being said, washing your hands is honestly one of the best things you can do because this virus is encased, or actually has a lipid layer around it, and so lipid, which is a fat layer, is emulsified or broken down when you use soap. So if we can inactivate the virus by basically crumbling down this lipid layer just by washing your hands, that's one of the best things that you can do. So those are just kind of like the housekeeping things with this virus that we do know, and more research is coming out on how long it's lasting in the air, how effective how infectious is this virus once it's in the air or once you touch surfaces. They're getting more information that way. An interesting topic that is fairly new is medication. Specifically, they're talking a lot about hydroxychloroquine. Hydroxychloroquine is an antiparasitic drug. It's an anti-malarial drug. It is often used in patients that have autoimmune, specifically lupus. And I think this is a really important topic to discuss because when this first came out, I was seeing a lot of people in the medical community being real quick to dismiss this and say there's absolutely no way, you can't claim this. And while on one hand, I understand that there is this, you can't just go out there and say this drug is going to cure this or it's going to be helpful, I think we need to take a step back and not be so black and white and trust the research. Once we take away the label of an antiparasitic drug helping for be an antiviral, once we take that label away and understand and truly understand the mechanism of what hydroxychloroquine does, it really will, I think, make us think a little bit differently of how we can use it. So the thing to consider about hydroxychloroquine as an antiparasitic drug is that chloroquine is a zinc ionophore. So what this means is that a zinc ionophore creates a pathway through the cell membrane for a 2+ ion, and zinc is a 2+ ion. So what this means is that when this creates a pathway through the cell membrane, which zinc normally cannot get through without this pathway being made, then it allows the zinc to get into the cell and stop the RNA replication, which is what happens when this virus infects. So zinc will essentially, like I said, cross the membrane because of the zinc ionophore from the chloroquine, and it blocks the enzyme that replicates the viral RNA. So there's argument to say, or maybe even question, if you're on a hydroxychloroquine, would you need to then be on zinc alongside of that to get the zinc into the cell membrane to act as the antiviral? So hydroxychloroquine may not be the antiviral that what they're talking about, but you need zinc alongside of it to go through that pathway to turn off the enzyme to stop replicating this RNA. So it's just something to again, I think sometimes we need to take a step back and not be so quick to dismiss this information. I'm not saying that it is going to be the cure or that it is the answer, but I think we need to just trust the research and not be so quick to think that we know everything, because there's a lot of really good studies out there showing that this could potentially be helpful, at least in the meantime, until they figure something else out. So I thought that was really interesting on the mechanism between that drug and how it affects the virus. The other thing that I think that is worth talking about is the health of our respiratory system. Knowing that the mucosal membrane is the first, like I said, entry point for this virus, it can live in our sinuses and in our nasal passageway for up to 4 days before it actually makes its way into the lower respiratory system. Knowing that, we just want to do our best to make sure that the level of inflammation, that the amount of mucus that your body actually makes is at a lower level. So we want to lower inflammation and lower mucus production. One of the best ways that you can do that is really decrease your dairy intake. Dairy actually promotes and increases mucus production. And so if we're on a quest to lower our susceptibility and lower our inflammation and lower the environmental factors that could potentially create an environment to house this virus, I would just suggest staying away from dairy, because we know 100% that actually produces mucus. And so we just want to do everything we can to set ourselves up for success now, and then post-quarantine, post-physical distancing. That's one of the best things you can do. Eating a mucolytic diet, eating an anti-inflammatory diet, That's going to look like low sugar, like I said, low dairy, warm or hot liquids like bone broth, hot tea, hot lemon water. Those are things that can help break up the mucus that's in your nasal passageways, and then help flush that down into the gastrointestinal system. Another source of research that is being studied right now to help with antiviral benefits for if you're looking for natural agents is quercetin. Quercetin is a bioflavonoid that is typically going to be found in a lot of your natural agent or natural immune supports, natural antihistamines. But remember, I talked about how chloroquine and how it works with creating that pathway or that passage system for zinc ions to get through. They're seeing in research that quercetin is a natural zinc ionophore, and that is how it's going to have an antiviral effect. So it's still being actively researched, but I say, hey, if they're even researching it or looking into it, you might as well try to implement some quercetin. I have my favorite forms of quercetin that I incorporate with myself and my patients that I'm happy to share with you if you reach out to me. But it is being researched as a natural zinc ionophore, much like how the chloroquine is being researched as well. So some things that you can really do, some of the basics are going to be anti-mucus producing foods, anti-inflammatory foods. Vitamin D and vitamin C are really important now more than ever. Studies show that if you are deficient in vitamin D, then you are more prone to getting infected with not just viruses, but just any kind of infection. So you really want to make sure that you have optimal vitamin D levels. Vitamin C is a very powerful antioxidant for your immune system. So those are really great foundational pieces that you can, and building blocks for your immune system as well. And then some other basics that we cannot ignore that you have total control over are sleep and stress management. Sleep is going to be vital for something like this because it does help you manage your stress better by balancing your cortisol hormone, but also it's going to help you set you up for success the next day by having that healthy level of cortisol and having you be more resilient to your stressors, because stress lowers your immune function. So we want to do everything we can to optimize our immune system function, and that's going to be looking like food, nutrition, staying hydrated, anti-inflammatory ways of eating, sleep, stress management, all those foundational basics that have always been proven but are now vital more than ever. So I think that's all I have for right now. As soon as we get more research and more information to go off of, we'll be sharing it with you. Please feel free to reach out to me with any questions or concerns about anything that I mentioned or anything moving forward specifically about this virus. I want to make sure that whoever's listening to this feels like they are set up to become strong and resilient now and when we get back let out into the wild. So stay well and stay healthy, and we will get through this together, and hopefully all of you guys are doing well. So take care.